Hello and welcome to the third episode in this pelvic floor podcast series. The first two episodes should have really prepared you for today because you should be a pelvic floor superstar by now, doing your exercises regularly 3 times a day, a combo of long holds and quick flicks. And this is great because today we are chatting about all things incontinence and prolapse, for which we know pelvic floor training is a very important tool for. Now, we know that 1 in every 2 women who have ever had a baby will experience prolapse and 1 in 3 will experience incontinence. So wherever you are right now watching this, have a quick look around you because chances are some of the women around you have these troubles right now. And it is time to talk about it more, to share our wisdom and our experiences so that women don't feel so alone. And in today's episode, we will be sharing some Pregnancy Posse member stories from Kate and Briony about their experience with pelvic floor dysfunction, which I think you'll really love that aspect of today's podcast because it's so relatable and helpful to know that other women are experiencing these problems too. Hello ladies and welcome back to the third episode in our pelvic floor podcast series. By now you have learned about where your pelvic floor is, why these muscles are so important, how we can exercise them correctly, and how often we should be doing them. So now that you're a fully fledged pelvic floor superstar, let's talk about some of the things that can go astray when it comes to pelvic health. The 2 most common issues I treat in the clinic and see within my online Pregnancy Posse community are incontinence and prolapse. 1 in 3 women who have ever had a baby will experience incontinence and 1 in 2 will experience prolapse. So if you haven't heard of these issues before, chances are that you will soon. And if you are someone who is currently suffering from this, I want you to know that you are not alone. There are so many successful and effective treatments out there, but also that it's not normal. Too often these things are assumed to be part and parcel of pregnancy and childbirth, or even more broadly, just being a female. That is wrong. We are designed to be continent. We are designed to have our organs supported in the pelvis. However, there are a number of risk factors common to many females, which can increase our chances of having these issues, namely pregnancy and childbirth, but also things like constipation and inappropriate exercise programs. I do not want you to listen to this podcast and be scared, to freak out and get on the phone to your gynae today because you think that there is something drastically wrong with you. I also don't want you to think that this is a reason to be fearful of pregnancy or childbirth, that it is inevitable that something will go wrong and you'll start leaking. None of that. This podcast is to help you understand these issues so that you are better informed and well equipped with the tools and knowledge necessary to prevent these problems from happening in the first place, but also to try and manage them as best you can if they do happen to pop up for you. Now, it is a balance, but I want you to see how both incontinence and prolapse are very common and therefore you shouldn't feel broken or damaged or alone, but they are also not normal and therefore you should not just accept that there is nothing you can do about it and should just put up with these symptoms. So I hope that makes sense. I wanted to clarify that. Now, incontinence is the involuntary loss of urine or feces. And for this podcast, we will be referring only to urine loss. I feel like we'll do fecal incontinence in another topic on another day. Now, there are 2 different types of urinary incontinence: stress incontinence and urge incontinence. Stress incontinence is when you lose urine after increased intra-abdominal pressure, for example, coughing, sneezing, running, or jumping. Whereas urge incontinence is when you lose urine associated with a strong and sudden urge to empty your bladder. For example, when you're busting to go to the toilet and you have an accident before you get there. There are 2 different treatments for these 2 types of incontinence. Most clients who come to see me think that they are leaking because they have a weak pelvic floor. Now, whilst this is the case for the majority of women that I see, there are also many other factors to consider and to potentially treat as well. Some women have stress incontinence because they have lost support in their urethra and their bladder neck. Others have stress incontinence because they have lost coordination between their abdominal and pelvic floor muscles. Some women are doing inappropriate exercise, which is placing excessive force on their bladder and pelvic floor, and these are just a few factors that we as physiotherapists will assess for you. Those women who have urge incontinence may also have a weak pelvic floor, but they may also have an overactive pelvic floor, which I'm going to touch on further in episode 5. These women may also have an overactive bladder, They may be drinking too much or too little fluid. They may have behavioral issues with their bladders because, yes, bladders can be like misbehaved pets. We do need to retrain them and be disciplined at times. Or they may have habit associations that we need to try and break. Now, the point of me telling you all of this is because most people think they need to strengthen their pelvic floor if they have incontinence. And this is the case for the majority of women, but there are also a lot of women who need more than that. That's why I would always suggest seeing a women's health physio, particularly if you've tried doing pelvic floor exercises and don't feel like you are improving, or in fact feel like you are going backwards. Then there are other factors that need to be assessed and treated. Other options for treatment can include things such as bladder retraining, modifying your fluid intake, or using a continence support device. And this is something that you place in the vagina, often for sport, which helps to stop or lessen the leakage. And if you do think that this might be an option you want to explore, please do speak to your doctor or your physio about continence support devices. They can be wonderful. We're going to cut to Pregnancy Posse member Kate's story now, where she chats about her experience with pelvic floor dysfunction, and she's super open and really honest about her experience, and I think you're going to love it. She will talk about the shock horror about having incontinence at 18 weeks of pregnancy, how she did not expect that at all. She's also going to talk about something that's not so often talked about, and that's experiencing some fecal incontinence after birth, which again caught her by surprise. But Kate shares what she did to manage this, how she got herself back on track, and realistically the time frame that it took for her to start to notice improvements in her symptoms. And trust me, it's a happy story, so listen all the way to the end. I think you'll learn so much about Kate's story.
During pregnancy, I was working in childcare with 2-year-olds, and so lots of up, down, twisting, bending, like quite a physical job, I would say. And I remember quite distinctly, like this one particular day, I bent or moved in a particular way, and I was like, something's just happened. And it was just like a little, like a urinary leak. And I was like, what is this? Like, I'm only 18 weeks pregnant. And so it was quite shocking, I guess. Like, I didn't expect that at 18 weeks pregnant. Possibly, maybe would have expected it further down the track, but being so early on, I was shocked. And so from there, I thought, well, I better go and see a pelvic floor physio. And I got some guidance on what to do during pregnancy. And then it kind of all changed a little bit after birth. I had those urinary leaks during pregnancy, and then afterwards it kind of became more so to do with my back passage, and I didn't expect that either. I possibly did expect some urinary leaks to continue postnatally, but staining of the underwear, I was just like, what is this? Like, it's so confusing. And then like, who do you talk to about it? Like, it's embarrassing. That was kind of the beginnings of the journey for me to learn more about the pelvic floor, how to strengthen it, how to recover from birth. It kind of sent me on the path of helping myself. The first couple of times that it happened, I was kind of like, oh, I've done something wrong. Like, I obviously didn't clean up well enough after I did have a bowel movement. But then I came to realize it was nothing to do with how efficiently I had wiped after having a bowel movement. It was all to do with the fact that my muscles weren't strong enough to hold everything in place. The physio spoke to me about trying to implement them in little things, like when you open the fridge door, something that you do quite repetitively, trying to just think about it. And I always thought about it when I opened the fridge door, but I kind of never put that in and actually did them. I think the best thing for me was every time I got into the car, I would think about it. And like then whilst I'm sitting and driving, I would just do a few contractions. I really had to prioritize it. When it becomes a priority, like you put it at the top of your list and then it becomes something that you do. So I think of other jobs around the house, like, oh, I've got to put on a load of washing or I've got to hang that washing out. And then that's that thing that you do the next time you have a free moment. Our morning routine is quite structured, I suppose. Like, we get up and we open up the blinds and we feed the dog and then we change Chloe's nappy. And then after breakfast and when she's going down for her first nap, that's when I do my pelvic floor. So it's kind of my priority first thing in the day. When I have that spare moment, that's when I do it. It did resolve. I would say it definitely got better. I felt stronger. I felt more confident. Like, there was a period of time when I was just wearing incontinence liners just in case. She really guided me on how to strengthen my pelvic floor and what to do, when to do it. So up until that point, I would get into bed at 10 p.m. or, late in the evening, and oh yeah, I should have done my pelvic floor. And so I do a few contractions like before falling asleep, which was really pathetic. Like,
Yeah.
you're not gain any strength when you're so tired at the end of the day. With the pelvic floor physio's guidance, she put me on the path of doing the exercises first thing in the morning. I kind of built it into my routine. It would either be whilst I was eating breakfast or whilst I was driving to work. And so I was switching on those muscles first thing in the morning, so then they could support me throughout the rest of the day. With birth, we think of all these worst case scenarios, but we don't really think of that for recovery afterwards. And something that the Women's Health Physio also pointed out to me is what we do now as recovering mums is going to affect our continence or incontinence when we're 60, 70, 80 years old. Like, all I had thought about was, I would like to have another child or a couple more children. This is my first. And if I can't heal from this one, like, how can I possibly have a second? But yeah, no, it's so important to think about long term where you want to be when you're 70 years old. So I'm 6 months postnatal now, and I feel like I'm on the up, like, just.
Yeah.
So I started doing some physio-led rehab exercises, just 20-minute classes online, which have been fantastic, but I've not yet progressed to the standing classes. So I'm doing the mat classes, kind of like yoga type Pilates exercises to re-strengthen core and glute muscles with a very strong pelvic floor focus. And I know that if I do too many classes too close together, I still get a lot of fatiguing and just that kind of weight sinking feeling within my pelvic floor. But I did a class a couple of days ago and I didn't have any back pain and I didn't have that sinking feeling. And I said to my husband, I think I'm on the up.
Yay.
Like, I think I'm getting there. 6 months postnatal.
That's
Here
so
we are.
good. Thank you again to Kate for sharing so openly and honestly about her story with pelvic floor dysfunction. This may or may not resonate with you and your experience, but I think it's so important to share these stories so that it's not such a taboo topic and so that we can see that women have problems after birth and that there's something you can do about it so you don't have to feel so alone. So I really hope you enjoyed Kate's story about fecal incontinence, urinary incontinence, and the importance of seeking help and remembering to do your pelvic floor exercises. Now we're going to cut to my chat with Briony, who is a Pregnancy Posse member, and she shares openly about her experience with incontinence, which was different to most people because it was quite insidious. It wasn't a really obvious leaking that she noticed. And she also talks about the importance of realizing postpartum when things are not normal and whether or not your practitioner says, oh, you'll be right, move on. If you know within yourself that this is not okay, about the importance of exploring that and going and seeing a pelvic floor physio and getting back on track. And Briony really talks us through her journey through postpartum pelvic floor rehab and the amazing results she was able to achieve. And her advice is really solid and sound. So I think you'll enjoy this snippet from Briony.
The incontinence wasn't severe. It was just like once I had recovered enough to stop wearing like maternity pads and stuff, I was just wearing a liner because I couldn't feel it happening, but I'd go to the toilet and be like, oh, right. So it wasn't like had no control, but it wasn't controlled as it used to be. So I think it was, I mentioned it to my maternal health nurse and she kind of said, oh, okay, well, just keep an eye on it. And, you know, and then in the end I said, no. Like, I want further advice and help on this. She actually said, oh, well, you can see a pelvic floor specialist physio. And I was like, I didn't even know they existed. Like I knew physios existed, and I knew but as a specific person to see after birth for pelvic floor, I just didn't know that was a thing. And when as I said, when I saw her, she just literally felt like she'd saved me. I just thought, why is this not part of the protocol post birth? Well, there was no protocol for me, and that was really disappointing. What I liked about your Posse membership was that they were short. They were so doable. Like there was no excuse. It wasn't like, oh, I don't have half an hour. It was like 5 or 10 minutes or something, And if you wanted to do a couple more sets, then you would record it or whatever. Then it was easy to do that or do it again later in the day. So it wasn't like too time consuming. For the time it takes, the result is so worth it. That, and just, I would say my biggest thing would just be, if you've got an issue or something doesn't feel right, then find the help that you need rather than just get sad about it. I mean, that can feel kind of easier to do. And it's taken me until this time to actually get a label for what's happening to my pelvis. So I said to my osteo, what are we calling this? And he was like, chronic pelvic instability. And I was like, great, okay, we're going to, I'm going to get rid of that. Like, I don't want to not be able to go for a big long 5K walk, because that's what I love doing, and I can't do that at the moment, which mentally that's taking a toll, not being able to get outdoors and do fun stuff like that. But yeah, I would say my biggest bit of advice to anyone would just be, don't just ignore it or think it's too hard to address, because it's totally worth doing something about.
I hope you love that snippet from Briony's story. I think her advice to women about not settling if something doesn't feel right is so very important. So that is just absolute gold. Do not settle. If something is not normal, make sure you go and seek help. Now, let's move on and talk about prolapse. So prolapse is when your pelvic organs descend down into the pelvis, most often into the vagina. And this often results in the feeling of a lump, a bulge, a drag, or a heaviness in the pelvis and vaginal areas. Other symptoms that women may experience include troubles emptying their bladder or their bowels, incontinence, or difficulty and pain with sex. Prolapse often occurs because the support structures holding your pelvic organs up, which is your uterus, your bladder, and your bowel, can become stretched or torn. Now, pelvic floor muscle strengthening can help to improve your symptoms of prolapse amongst a whole host of other treatment options. A good way to understand prolapse is to imagine the vaginal walls are like your breasts. Now, hear me out. This is a really good analogy. It will probably only make sense to those of you who have already had children, but your breast tissue sits a lot lower after having children than before children. So what do? We put on a well-fitting support bra and pretend like our breasts sit in the same anatomical position that they used to. Now, this is a great analogy for the pelvic floor. The vaginal walls will always be softer and stretchier after pregnancy, and particularly after a vaginal birth. This will take time to recover. It will take time for natural healing, as well as time for our hormones to settle back into place. It will also take strength and rehab of the pelvic floor muscles. Our pelvic floor becomes like this support bra. So whilst our vaginal walls are now softer and stretchier and sitting lower than before, our pelvic floor can help to pull everything back up and into their original anatomical position. So this is how pelvic floor muscle training can help reduce your symptoms of prolapse. Other important things to consider with prolapse are to avoid constipation and straining on the toilet, as this can continue to weaken the support structures that hold your organs up. And I really do think I will dedicate an entire podcast show down the track to constipation and managing this, because it is so common during pregnancy and it is such a big risk factor for prolapse. It is also important to be mindful to stop or limit any activity that causes you to have prolapse symptoms. So for example, if you go for a 1 hour walk and you feel heavy or a lump in your vagina, this is a sign that you are overloaded and you've gone too far. So instead, can you go for a 30-minute walk and feel okay? And if so, start here. It doesn't mean you'll never be able to walk for an hour again. It just means that right now, this is what your body is capable of. And as you gradually work together with your physio to improve your strength and support, you will definitely be able to do more down the track. And this is personally why I love using the stationary exercise bike for so many of my pregnant and postpartum clients with prolapse. Because the bike allows you to get your heart rate up, feel the burn in your legs, get the endorphins pumping, sweat a little bit, but all whilst being fairly low impact on the pelvic floor and therefore not making your prolapse any more symptomatic. as opposed to running or HIIT style training, which often can aggravate a woman's prolapse symptoms because of the higher intra-abdominal pressure. So with cycling, you get the same flow of sweat, the muscle burn, the endorphins, but with less impact on the pelvic floor. So I personally think it's a great win-win for my clients. Now, let's do a quick recap. 1 in every 2 women who have ever had a baby will experience prolapse, and 1 in every 3 will experience incontinence. Now remember, this is not something to be afraid of, but something to be educated on and not put your head in the sand about. So whilst it is common, it is not necessarily normal, and therefore you should not just put up with your symptoms because you think it's a normal part of pregnancy or childbirth. There are so many options to improve your symptoms, including, but not limited to, pelvic floor exercises. So we know that pelvic floor muscle strengthening has been shown to improve urine leakage and prolapse symptoms. So I personally think what better way to get started, get motivated to get started on your exercises today. Now, as always, I'd love to finish off with some rapid fire questions I have been asked from my lovely ladies inside the Pregnancy Posse, as well as on Facebook and Instagram. Let's go. Question number 1, how will I know if I have a prolapse? So most women with prolapse will feel a lump or a bulge in their vagina or a heaviness or dragging sensation in the pelvis or vagina. And other common symptoms are incontinence and difficulties emptying your bladder or your bowel. Question number 2, is there any use doing pelvic floor exercises during pregnancy if vaginal birth is just going to stretch everything anyway? Ooh, I really love this question. I've had so many women ask me this, and even worse, they've been told this by family, friends, or other health professionals. Ladies, remember this. Do not wait to start your pelvic floor exercises until after birth, because the best time to start is right now. So whether you're 4 weeks pregnant or 39 weeks, start now. The stronger and more coordinated your pelvic floor muscles are before birth, generally the better your birth and recovery stage will be. If you were waiting to have knee surgery, for example, your surgeon would advise you to start strengthening your leg muscles right now because it will dramatically improve your post-surgery outcomes. And the same goes with the pelvic floor. Next question. I'm in my 2nd pregnancy and generally feel a little heavier down there. Is this prolapse? Good question. Possibly. It can be common in subsequent pregnancies to feel more pressure and heaviness in the perineum, which is not necessarily prolapse. If it's more of a general pressure as opposed to a specific vaginal pressure or bulge, and it is not associated with other symptoms such as incontinence or troubles emptying your bladder or your bowels, then it may not be prolapse. It may just be from all the extra blood flow in the pelvis, which can make your perineum feel heavy. However, I always think it is best to get checked by a physio just to make sure. Now, last question. Should I stop exercising if I have a prolapse? My answer is absolutely not. This is a common myth that I'd absolutely love to bust right now, because prolapse should not stop you from exercising. Sure, you may need to modify what you're doing. There are certain activities that will definitely aggravate your symptoms, and these are best avoided. However, we want to keep you as fit, strong, and conditioned as possible, as this will always help your prolapse symptoms. So work together with your physio to find what exercise program suits you well, but definitely do not stop exercising altogether. Whew. Well, ladies, so much covered in today's episode. I hope you now have a much better understanding of incontinence and prolapse and are feeling less scared about these issues, but instead more empowered and educated. Now, let's not leave before we do today's pelvic floor exercises together. So let's change it up today and do 15 quick flicks or repeated contractions. So try to follow along at my pace, but if you're finding it too difficult, just go as quick as you can. Remember, technique is more important than speed. Okay, let's go. Relax all your muscles. Now squeeze and lift around the vagina. Let's go. On, off, squeeze, lift, squeeze and relax. Squeeze, relax, squeeze, relax. Relax all your other muscles. That's 7, relax. 8, relax. 9, relax. Keep going. Should be a secret. Good. Keep breathing through. That's 12, squeeze, relax. 14, relax. Last one and relax. Well done, ladies. So I hope you enjoyed that episode and found it helpful, whether you're experiencing incontinence and prolapse right now or whether you want to be prepared with all the knowledge to manage this in the future should it ever pop up for you. I'll catch you soon for episode 4, where we chat about a very common issue that presents in women, which is having an overactive pelvic floor. So a pelvic floor that struggles to relax and is too tense or too tight. So I'll catch you soon.